Good afternoon. Let's begin with an overview of the data. As of Saturday, CDC reported the 7-day moving average of daily new COVID-19 cases to be about 72,000 cases per day. This represents an increase of 44% from the prior 7-day average and higher than our peak of last summer. The 7-day average of hospital admissions is about 6,200 per day, an increase of about 41% from the prior 7-day period. And 7-day average daily deaths have also increased to 300 per day, an increase of more than 25% from the previous 7-day period. I want to start today by simply stating the obvious. While we desperately want to be done with this pandemic, COVID-19 is clearly not done with us, and so our battle must last a little longer. Many of us have lost loved ones or have been ill ourselves. All of us have given up things in our lives that we enjoy. This is hard, this is heavy, but we are in this together. And as we learn more about COVID, we continue to rely on proven ways to protect ourselves, our children, and our loved ones. I told you I would give you scientific information as I have it, when I have it. Here is what we have learned in the last 2 weeks about the Delta variant. First, the Delta variant is highly contagious. To put this in perspective, if you get sick with the Alpha variant, you could infect about 2 other unvaccinated people. If you get sick with the Delta variant, we estimate that you could infect about 5 other unvaccinated people, more than twice as many as the original strain. Second, infections with the Delta variant result in higher viral loads. This means that those who are infected have a larger burden of virus that they can spread to others. Third, those higher viral loads are seen not just in those who are unvaccinated and infected, but also, and importantly, in the small proportion of those who are vaccinated and become infected. Last week, we published data on an outbreak in Barnstable County, Massachusetts, where there were 346 confirmed cases of COVID-19 in people who were fully vaccinated. During the summer, some towns in Barnstable County can have up to 240,000 visitors per month. Those with breakthrough infections had viral loads that were similar to people who were infected and unvaccinated. This new finding, combined with data from other outbreak investigations and surveillance studies across the country, was critical in our decision to update our guidance for those who are fully vaccinated. Since those data were released, several other studies have been released over just this past weekend that have corroborated these findings. Taken together, the Delta variant is different from prior strains. I understand this is all frustrating news, and I share this frustration. We continue to learn each day from emerging science and use this evidence to update our recommendations. Because of what we now know about the Delta variant and infections in those who are vaccinated, we updated our recommendations, including recommending masks in public indoor settings in areas with substantial and high transmission, shown in orange and red on this map. It is also the reason we continue to recommend universal indoor masking in K-12 schools throughout the country so our children can safely get back to school and safely stay there. In all of this, there is still good news. Our vaccines are working to prevent severe illness, hospitalizations, and death. Vaccines are providing protection both for individuals and communities across the country. As I have said before, this remains a pandemic of the unvaccinated, where the vast majority of spread in this country is among those who are unvaccinated. I want to be clear. While vaccinated people can spread the virus if they get a breakthrough infection, the odds of them getting sick in the first place are far lower than those who are unvaccinated. And in fact, places with more vaccination generally have less disease. We can see this on a population level on this slide, where we compare case counts and vaccination coverage by state, with vaccination coverage on the horizontal axis and case counts on the vertical axis. States with the highest vaccination coverage are the dots furthest to the right on the graph, and states with the highest case counts are the dots closest to the top. Notice that the states that have lower vaccination coverage, those further to the left, have higher rates of community transmission, as shown in red and orange. States that have higher vaccination coverage, further to the right, have lower rates of cases, as shown in yellow. There is a direct correlation with vaccine coverage and case rates. And I think it's worth reiterating that public health prevention strategies, including masks, continue to work while you're unvaccinated. In the following outbreaks of cases in Barnstable County and in subsequent public health follow-up, we saw the power of vaccines and masks. Over the month of July, there were a total of 934 confirmed cases of COVID-19 linked to the outbreak in Barnstable County. With 73% of these infections in people who were vaccinated, there were only 7 hospitalizations and no deaths. Our vaccines did exactly what they were supposed to do: prevent severe disease, hospitalization, and death. Furthermore, as cases increased, local public health officials implemented a package of public health prevention strategies, including increased testing, contact tracing, and indoor mask wearing. And within 2 weeks, test positivity fell from a peak of 15.1% to 4.6%. Public health prevention strategies work. Let me end by reiterating 3 things you need to know. First, our vaccines are working to prevent severe illness, hospitalization, and death. And if you are not vaccinated, please protect yourself and get vaccinated. Second, masks will protect you and your family. If you are in an area of substantial or high transmission, please wear a mask in public indoor settings, regardless of your vaccination status. And third, we need to keep our children safe and in school. Get everyone in your family over the age of 12 vaccinated, and please wear masks in school. Finally, we stand here with you, providing science and updated guidance in real time to keep you and your families safe.